So I am making a video on the new care plans that have the short-term goals and the long-term goals added to them. So I threw together some um, pretend goals in some patients and had some ideas from either other care coaches that had questions, and I used their patients' goals that they had. So I know change is different and it's hard. So with the short-term and long-term goals, we need to do it the initial time starting now with our patient. Now, next month, if you did the short and long-term goals they both need to be done. So if you did the goals this month of December, when you talk to the patient again in January, you don't have to do them again unless some of the goals have been met. So if this patient here meets one of their goals, you're going to document that. If nothing is met, nor short-term goal or long-term goal, just copy and paste this into your January note. And then each time you talk to them subsequent times after, just make sure you review their goals with them and change what is in here if something has been met. So we're just going to cover the goals section, but you can reach out to me if you need help with this, or if you have better ideas or stuff that could have gone in here that I did not include. I'm always open to suggestions. So this patient, is their first short-term goal is to not gain weight over the holidays. And they want to increase their time on the stationary bike at least to an hour daily. That's the goal that they want to get to. They're only doing maybe 20 minutes now. They want to eventually get up to an hour. So some interventions is going to be working on portion control. They're going to increase the exercise, and they're going to eat less sweets. So with this patient, some of the barriers that they have in meeting their goals is they have knee pain and they have no portion control. They eat as much of whatever they want at this time. So of course, and another barrier is they love their sweets. So for the outcome section, it's going to be in progress. It'll always say in progress until that goal is met. When that goal is met, you'll change that to met and go for another goal, another short-term goal. They always should have a goal to reach. And with this time of the year, it's good to have a conversation starter with them by saying, with the new year coming, what are some goals that you want to reach in the coming year, or things that you want to work towards in bettering your health? So that's a way to get them talking about their goals, because a lot of them are going to say, oh, I have no goals. I have a goal of waking up tomorrow. So try and get them talking about things that they want to do that's going to be better in the long run for their health. So this person's long-term goals is to lose weight. So their short-term is just to get through the holidays without gaining that weight. So their long-term goal, which is going to be an ongoing goal, is to lose weight. A good thing to do is add what their goal weight is. This one, I wasn't told what a goal weight was, so I couldn't add it to this. I mean, I could have, but I would put in there what their starting weight is, what their goal weight is. I would encourage them to take pictures, starting pictures, because a lot of us don't see our success of weight loss before others do. Others around us see it before we do. So it's good to have a starting picture of what you look like and starting measurements, because if you know the whole thing of 1 pound of fat is the same as 1 pound of muscle. The fat just takes up more room. So that's why they'll probably see results in the measurements before they will the scale. So they have lost 1 pound of fat, which is more dense and takes up more room so than the muscle does. So it will show in inches lost. So that's why we want to focus on the measurements more than what the scale says with weight loss, because that's where they're going to notice it first. So go by what the number on the measuring tape says, or what the size of their pants or their shirt, how it fits. If it starts fitting looser, of course, they've probably lost some inches. So long-term goal is to consistently keep up with that workout, and interventions that they're going to do. Interventions are something that they're going to do to work towards this goal. So he or she's going to continuously make better choices on food selection, work on that portion control. They're going to try adding a new workout routine, like adding something other than just the stationary bike that they've been doing, because we know as muscle memory, so if you consistently are doing the exact same thing, the muscle's going to remember that, and you're going to eventually hit a plateau where they're going to be doing all this workout, they're going to see no results. So you need to change it up sometimes, shock our muscles a little bit by adding something new, and that's when they usually can break through that plateau that we reach. And this person's also going to focus on how their clothes fit rather than the scale, which I said earlier. So some of the barriers that are kind of going to prevent them from reaching that goal are family stressors. Maybe there's, overeaters in the house. Maybe there are people that can eat things without worrying about it. Just any kind of family stressor, we know that a lot of people will turn to food to help with that stress. So they got to work on those family stressors and time management. They keep themselves busy that they don't set time aside for exercise. So the outcome still, until it's met, it's going to be in progress. So, and then I put in here, your patient's doing well. He or she has gone down a pant size. So always praise them in their accomplishments, whether they're small accomplishments or large accomplishments. Some people do better on that motivation and accountability. So that's the first example I used. All right, so this gentleman has a goal of stop smoking and to find a part-time job. Those are his short-term goals. So some of the interventions that he's going to do is reduce the amount of cigarettes he smokes per day by 1 cigarette. Presently, this patient, which you could probably add in here, is that patient presently smokes 1 full pack a day. He was doing 2 packs a day before this goal was set. So he's, already working on that goal. But so he wants to, right now for the short term, is to reduce 1 cigarette a day. So I'm not a smoker, so I don't know how many cigarettes are in a pack. So let's say there's 20. Don't call me out if I'm wrong, but he's smoking 20 cigarettes a day. So for 1 week, he needs to try and smoke 1 cigarette less a day, so 19 cigarettes a day. So at the end of that week, he's going to, if he was successful, he's going to smoke 7 less cigarettes. So that's an accomplishment. So the next week, he's going to try to decrease the amount of cigarettes by 2 less cigarettes a day, and so on. So each week, try to lessen the amount of cigarettes he's able to smoke. So another intervention is going to be stress relief. So as we know, stressors can either make whoever smokes, they may turn to cigarettes to relieve their stress. Some are emotional eaters, so they turn to food. Anything that we do in excess usually is what we turn to for stress relief. So, another intervention to do is get rid of temptations and only maybe buy 1 pack a day versus a whole carton. Again, I don't know how many packs are in a carton, but maybe if they don't have a whole carton and there's less availability of a cigarette, that's going to cause him to smoke less. Yeah, it probably is going to add to his stress, but it's a give or take thing. So you want to get rid of those temptations that are there. So he's probably going to gain weight by stopping smoking, but that would be another goal, would be to get rid of this weight that he is going to most likely gain from stop smoking, but his lungs are going to thank him. And then find a support system. Ask a friend or a family member to hold him accountable, and have them, ask, how you doing today? How many cigarettes did you have? Praise him by whatever he's accomplished, and even praise him that, hey, I know it's hard. It's okay. You may have backslid by one day and didn't cut out that one, but let's start again tomorrow. I hope that makes sense. It does in my head. Some of the barriers that are going to prevent him from meeting that short-term goal is maybe other smokers in the home or too much free time. If he's bored and not working that part-time job that he hasn't gotten yet, he's going to spend that time smoking, and he has no physical activity. Some of the outcomes, it'll be in progress, of course, till he meets it, and the patient will attempt to lessen his amount of cigarettes by one per day for a week, and then if successful, week 2, lessen it to 2 cigarettes per day. So long-term goal, weight loss. That's going to be, as I said above, maybe because of him stopping smoking. So interventions he's going to do is work on portion control, increase his physical activity, increase his water intake. Because if he's, drinking before he starts to eat, he's going to feel fuller quicker if he's drinking water. And then try and cut out sugary drinks, any of those unnecessary or those hidden calories. Try to, with that physical activity, try and burn off more calories than you're consuming. All right, barriers, family dynamics. His mother does all the cooking, so that does not help him with his weight loss. And his mother does all the grocery shopping. So outcomes, of course, in progress. Patient will start to cook his own meals. Choose healthier options from choices given. If it's, there's no way for him to do the grocery shopping, then if his mom's buying all the groceries, then choose the healthiest options in that what is put in front of him. If there's not a healthier option, then try eating smaller portions. All right, and then start your meal with drinking a full glass of water. Another outcome is going to be exercising at least 30 minutes per day, at least 5 days a week. So I hope some of this has helped with how to get in the routine of doing these short-term and long-term goals that we have to do with every patient. But as I said before, just do it the first time. And if none of the goals have been met, then you copy and paste the short and long-term goals into the new note. But if some of them have been met, you can still copy and paste, but take out what still needs to be met and put in there, they met this goal. So, like I said, if you have questions, reach out to me. I'll try my best to help. And thank you for all your hard work. Thanks. Bye.